Task Force on COVID-19. Let me also especially welcome the Honorable Minister of State, Labor and Employment, and the President of the Nigeria Labour Congress and his officials, distinguished ladies and gentlemen, gentlemen of the press. I welcome you all to the briefing for Friday, 24th April 2020. I begin this briefing for today by saying Ramadan Kareem to all our Muslim brothers and sisters nationwide. This is a season of supplication, and I pray that Almighty shall accept all our supplications, cleanse our land, and show mercy upon his people. Yesterday, the ECOWAS heads of state held a summit via video conferencing to chart a common course for the sub-region on COVID-19. The summit was concerned about the negative social, economic, financial, and human security impact of COVID-19 on all ECOWAS member states, as well as the serious threat posed to the regional integration process and regional peace and security agenda. I'm pleased to inform you that in consideration of the need to ensure high-level coordination of all the regional efforts to contain the pandemic, the summit appointed His Excellency Muhammad Buhari, President, Federal Republic of Nigeria, as champion to coordinate the COVID-19 response and eradication process in the ECOWAS sub-region. This is a monumental recognition for the leadership role of our President and an endorsement of the direction we are headed in our national response. The implication of this assignment is that the PTF must now factor the West African sub-region into its plans and activities to support Mr. President in his new role. I must add that the summit also set up ministerial coordination committees on health, finance, and transportation to coordinate regional efforts under the supervision of the champion. Today, the welfare of our frontline heroes, the health workers, came to the front burner. I'm pleased to inform you that the Federal Ministry of Health, working in conjunction with the MDAs and the health sector professional bodies, have signed an MOU for various allowances and other incentives. The full details will be unveiled to you by the Honorable Minister of Health very soon. I am, however, pleased to inform you that in addition to what the federal government is doing, the insurance industry has responded massively to the call for support. The Presidential Task Force has received a life insurance cover to all frontline workers on COVID-19 for a maximum of 5,000 health workers who are employed to fight against the COVID-19 pandemic. The premium in the sum of $112,500,000 for cover has been fully paid by the Nigerian insurance industry in line with the principle of no premium, no cover. The PTF wishes to thank the insurance industry immensely and calls on other sectors of the economy to rise up to support the efforts to fight COVID-19. I also call on our frontline health workers to double their efforts, just as we want to assure them of our determination to protect them. I informed you earlier in the week that the PTF has embarked on the assessment of the readiness of 9 states. These visits have been quite informative, and we have, as a consequence, strengthened our collaboration with states. The Presidential Task Force will be fine-tuning the directions and advisories in order to effectively guide the states and for uniformity of approach. I use this opportunity to once more commend the governments of all states visited for providing leadership and resources in their preparations. I also wish to use this opportunity to restate that food security and self-sufficiency remain important to our national life. I therefore urge all our farmers to begin to prepare for their return to their farms as the planting season is here. The Federal Ministry of Agriculture has put in place arrangements for access to farm inputs, extension, and other services. The Presidential Task Force continues to work assiduously towards presenting a report to Mr. President after considering all critical factors. Let me state that these are unusual times. We are in uncharted territories, and we need to forge ahead. As we work out our models, we also draw lessons from other jurisdictions that have had experiences to share. We shall, however, continue to pursue the strategy of aggressive testing, detection, isolation, contact tracing, treatment, and care. Finally, let me repeat my appeal to all Nigerians to continue to comply with all advisories. These are still the most efficient measures that can help us manage the ravaging virus. I now invite the Honorable Minister of Health to present his update and to most sincerely thank you for listening. Thank you.
Honorable Ministers here present, the Leader of Labour, Directors General, ladies and gentlemen of the press. Again, what I will say will reinforce much of what the Secretary to the Government has already put down. And as of today, 24th of April 2020, 981 people in 25 states of the Federation and the Federal Capital Territory have been confirmed to have COVID-19 infection. The 108 additional confirmations are as follows: 78 in Lagos, 14 in the Federal Capital Territory, 5 in Ogun, 4 in Gombe, 3 in Borno, 2 in Akwa Ibom, and 1 each in Kwara and Plateau. 197 persons have been successfully treated for COVID-19 and discharged home, while 31 deaths have sadly been recorded. Again, the high number of new cases is due to ongoing community transmission and also the very active and accelerated case search going on. From our test statistics, the most affected age group among the positives is the age group between 31 and 40 years, while the highest COVID-19 fatality rate is among the older generation above 50 years of age. We have now deployed COVID-19 starter packs to all tertiary health institutions and federal medical centers to complement what was earlier sent to each state. The starter packs consist of medical consumables and disposables to ensure that our frontline healthcare workers are protected, and also that there is synergy and collaboration between federal tertiary institutions and the host state health network. The COVID-19 capable National Laboratory Network, led by NCDC, has capacity to test over 1,500 samples per day in at least 13 laboratories, but the present utilization rate is barely 50%, since we averagely test about 600 samples per day, being the samples received at the centers. Efforts are on to increase the number of functional laboratories in the country. However, we need to meanwhile improve surveillance, sample collection strategy, and transport logistics to laboratories, and also reduce the turnaround time for tests. In our strategy, testing positive is followed by isolation and treatment as needed. Those who require no treatment still need to be in isolation in the interest of the public and their household. We urge all persons who have tested positive to comply, and for citizens to remember that anyone who has tested positive is not only just a private patient, but a patient of general interest. The COVID-19 virus has long since been declared a public health emergency of international concern. I wish to use this opportunity to applaud our frontline health workers again in the COVID-19 pandemic. Salute your courage and patriotism, but I urge you to protect yourselves as prescribed and use your personal protective equipment judiciously. Do not attempt to treat COVID-19 patients without using adequate PPE, or if your institution is not accredited to do so. This is important because we need to keep health workers safe at such a time and cannot afford the numbers who test positive to COVID-19 and have to go into isolation. Remain vigilant in the line of duty and maintain a high index of suspicion for this infection. I wish to appeal to all citizens to take the advisories that we give here daily and also repeat every time. Take these advisories seriously and adhere to the hand and respiratory hygiene, as well as the social distancing directives. The use of a cloth mask or face covering when you leave your residence is recommended, as is the injunction to avoid mass gatherings and non-essential travels. I wish to restate the advisory given yesterday to reduce risk of community transmission by reducing all non-essential travel, especially long-distance travel. This will help to reduce the risk of carrying the virus from one state to the other. Today, we want to join the rest of the world to commemorate World Immunization Day, World Immunization Week. The theme for this year is Vaccines Work for All, and is dedicated to promoting the use of vaccines to protect people of all ages against diseases and death. While waiting for the vaccine for COVID-19, let us collectively adhere to all public health advisories. Finally, I emphasize again that to defeat the spread of COVID-19 requires collective and individual efforts. If you suspect you have been exposed to COVID-19 or anyone around you has been, call the toll-free NCDC numbers and the emergency number of 112 and 0800-97000010. Resources and real-time information on COVID-19 can be found in the social media handles of Federal Ministry of Health and the NCDC, the Federal Ministry of Health website, and NCDC microsite. Please stay home, stay safe, take care of yourself, take care of your family, take precautions.
Dan Karim. So, COVID-19 has changed the way we live our lives in many ways. But one thing it hasn't been able to do is knock out our spirit as Nigerians. So I'd like to start today by really thanking everyone for your continued sacrifice on this journey and your continued cooperation with the lockdown as advised, instituted by Mr. President and many other governors across the country. As we traveled around the country over the last 4 days, we could really see how difficult it has been and how hard Nigerians have been trying to do their very best. We know it's a difficult journey, but we also know that we will eventually exit this stage and restart our normal lives, but that stage is still a while to come. And I ask for your endurance, your support, your patience. Lots of efforts are going on across the world to find new therapies, to find vaccines. Everybody is pushing very hard in this direction. So we need to stay firm and continue trying. We need really unprecedented levels of caution and to continue carrying out the preventive measures that we've advised severally on this platform. I'd like to really refocus and re-emphasize 5 of them, and really to ask everyone to support each other. When we talk about hand washing and respiratory etiquette, it sounds very difficult, and to be honest, it is difficult. Right now, I can't get back into my own household without being sent to wash my hands. And this is the reality. I don't rely on myself anymore to carry this out. Everybody knows in my household that they have to see me. So it's kind of supervising me to do the things I ask everyone to do, in recognition that none of us is strong enough to do this all the time. So I'd really ask everyone to find those checks and balances in our own lives, whether it's in our workplace or at home, to make sure that we do the things that we have to do. Physical distancing is very difficult, so we can't rely on ourselves either. So when you're on a queue and you're moving towards an entrance, hold back or ask other people to do the same, so you allow yourself some distance. This is not easy to do, but we all have to hold ourselves accountable for it. Face masks, as you can see, I had to take off mine to speak to you. I'll put it right back on after doing this. So we too have to hold each other accountable to doing this. It's come slowly, but now we have to accept that almost every time we leave our homes, we need to wear those masks. And it's not as if they're not important at home, but at home we're among a family, and any exposure within that family is difficult to control. So at least we keep whatever we have in the family, and when we go out, we prevent ourselves from spreading it. And spreading it, you do by when you go out. And we're an outgoing society. We live outdoors, we walk outdoors, so staying at home and thinking about every movement that we make is very important, especially when we feel the need to travel. And I recognize how difficult this is at the moment. Many families I know personally have not been able to bury their dead, have rescheduled their marriages, have rescheduled their baptisms, have rescheduled everything they're doing. So in a way, it feels like life is in suspense, or we have suspended so many of the things that we hold very dear. So I am sure that everyone on this side of the table recognizes the great sacrifice being made by Nigerians. But we only have to encourage each other to continue. Continue till we get to the position where we can relax some of that. But to get to that place, we have to continue in the short term. And finally, we must remember that the most vulnerable people to this disease right now are the elderly in our society and those with some comorbidities. What do we mean by comorbidities? Some other illnesses. We must protect them. And right now, protecting them is, if they're living in the village, please leave them there. Support them with whatever financial resources you can by sending them home. But please Now is not the time to encourage travel. Travel is difficult anyway, rightly so. But really, if you have anyone that in your family, in your society, in your church, whatever social congregation you have, these are really the most vulnerable in our society right now to this new disease, and we must protect them as much as possible. So now to conclude, we're all working hard to get to the point where we can relax some of these measures, but we're simply not there yet. So we ask you to join us, continue on this journey with us, amplify the messages that we are giving. There's no amount of risk communication that we can carry out through our different means that can get to every Nigerian. So we need every message sent out to be amplified several times more. We're very happy to have the leadership of the Nigeria Labour Congress here with us today. We really need your support in sharing these messages, encouraging our citizens to stay firm and join us on this journey. We will get to the end of it, but in the short term, we're asking you for some additional sacrifice as we continue to work hard to flatten the curve and see that we ultimately get out of this pandemic.
I would like to first of all start by saying that the PTF would like to assure the public that we continue to closely monitor the situation in Lagos, Abuja, and Kano, given the increasing number of cases that are coming up. We are working with all the state structures, including the state task force teams and the state emergency operation centers, to ensure we control the pandemic sooner rather than later. In terms of grassroots sensitization, which continues to be extremely important for the control of this pandemic, we'd like to reiterate the need for all state structures involved in the COVID-19 response to continue to engage directly with grassroots, particularly at the local government level, to ensure every member of society understands the pandemic we are facing. I would like to thank the National Orientation Agency and the various donor organizations that have been supporting community sensitization at the community levels. The government is also aggressively driving grassroots awareness through established state and local government sensitization committees and community mobilization structures like health educators, traditional leaders, and faith-based groups. We thank all these for assisting with the response. We will continue to expand our outreach, working with the state governments to ensure every Nigerian has access to life-saving information on COVID-19. Sticking to the theme of Ramadan, we'd like to re-echo the need to abide by all protocols, especially avoiding gatherings, wearing of improvised face masks, and hand washing during Ramadan. The task force has launched Ramadan messaging on radio, social media, and television to ensure our Muslim brothers and sisters are aware of the safety protocols. I would like to specifically thank the Nigeria Supreme Council of Islamic Affairs for their support and clear guidance to the Muslim community. As much as we encourage people to stay at home, it is also important that we all stay socially connected in one way or another through the various platforms, online platforms if we can, and through telephones, etc., and support each other during these trying times. Thank you.
Honorable members of the task force, the chairman, or the president of the Nigerian Labour Congress and the executive, ladies and gentlemen, I just want to make a clarification. Yesterday, a gentleman asked a question here, and if I remember, he asked about a petrol attendant that was killed last week in Abia State. My response yesterday was to the incident that happened on the 17th of April in Abia State, which was last week. Prior to that time, there was another incident which happened on the 5th of April, where also a petrol attendant was killed. But that was not the question I was asked yesterday. That was not the question I addressed. I found later in the evening a statement by Nupeng, and I think it's important for me to make the clarification. The issue I addressed yesterday was the issue of the 17th of April. I had the opportunity this morning also to confer with the IGP, who also confirmed that yes, something happened on the 5th of April, but the culprit has been arrested and is facing the internal disciplinary measure before he will be prosecuted. So I just want to make a clarification. I was addressing the incident that happened on the 17th of April. And the question that was asked was actually about last week, not what happened on the 5th of April. Thank you very much.
For any doctors to be pulled out of service, we need all at this time. We need nurses, we need laboratory scientists, we need all hands on deck at this time. But the people who were laid off, I think there must have been reasons, administrative reasons, which I do not know about. But again, if the reasons are strong enough, then it's not, they're probably looked into by the board of the hospital, and we shall be advised accordingly. Now, as for the burial of COVID-19 victims, I'll ask the NCDC to give the details of that one, and also about the decontamination. Now, for the health insurance, the Secretary of Government did say that the Minister of Health will say something about it, but not now, because there are still a few T's to be, and I's to be dotted and T's to be crossed. So the time frame for that will not be today, because the details will come out. But it is definitely something in question. It has gone very far. Just a few more details that need to be put in. And those who tested in Mabushi 40, I think I'll leave that to NCDC to answer. But the question of isolation, any place where you have an isolation center, we have to have a complement of health workers who are monitoring the persons. Some of them have symptoms, and we can call them patients. Others who have those symptoms are, in fact, probably not even called their patients, they are just on observation. But they need to be monitored, they need to be looked after. So the strategy right now is to have functional isolation centers in every state. If the need arises, there are backups. We have multiple locations. We also have, in far advanced stage, a policy for setting up ambulance service to transport COVID positive patients. So if somebody tested somewhere, they can be brought by an ambulance. So you can have one center where everybody will be looked after in the same way. And all states will get ambulances. And the training needed for both the drivers and the stretcher bearers there. It is better to concentrate things in certain areas. Some states might like to use other interior districts, but it depends on how many centers that are needed. In Lagos, for example, there are various treatment centers, not looking at local government, but looking at availability of the infrastructure and the hospitals that are adequate for that. In some cases, some hotels are being used too. So it depends on the need, actually. The question of door-to-door sampling, well, the NCDC will answer that, and also the questions of discharge. Yes, there are persons who are due for discharge. Before someone is discharged, you must test negative 2 times. The first time you do a test, they are negative, and then you wait about 48 hours, do another test. When the result comes out, they are negative again, then they can go. So because of that, you don't have people just coming out being discharged anyway. You observe that they are discharged generally in batches. So a group of people test negative 2 times will be discharged. So the process is on. People are getting well, people are getting better, and there is no need to conclude that it's not happening. I think that's all, and I'll invite the Director of NCDC to answer the other questions on Mr. State.
Kano Lab, we suspended testing for a couple of days. It's a routine measure. They'll be back on today or by tomorrow, actually. So that's not a major problem. In terms of the elderly population, I think we're not a bad place in Nigeria that we don't have too many care homes and collection of elderly people in specific locations. So we're actually in a privileged position. So I think asking what government can do specifically is a fairly difficult situation. I made that comment to encourage all of us to work together to see that we protect this population and prioritize them in the work that we're doing. The question on test results in Plateau, we never make our test results public for individuals. So if those things are public, they'll be made public by someone else. So we never make our results public. Unfortunately, sometimes these things get out through different means, but we will not confirm, we will not deny, we never discuss individual results of anyone. In terms of malaria and COVID, malaria is endemic in Nigeria, and I think the emergence of COVID only reemphasizes the need for us to focus on malaria diagnostics. We actually have a very effective malaria test, a rapid diagnostic kit. The challenge is that many of us don't like using it and assume that we know what malaria is by teaching, by touching, by looking at people. But the truth is that there are many other causes of fever in our environment, so we have to really start rethinking about how we prioritize diagnostics in our health system altogether. The question on the projected peak of cases, unfortunately, we're not able to have a specific projection at the moment because it depends critically on the work that we do now, both on our side and on your side. So everybody should keep working hard on everything we've been speaking about to get the peak flattened as much as possible. The question on Mabushi, again, we don't, FCT is leading on the community testing, and they have decided specific communities that are at specific risk and are dealing with that the best way they can. Our challenge at the moment is not really in identifying contacts. So I don't think the use of technology for that is our biggest challenge. Our challenge is really for people to accept the importance of what we're doing. We're not the police or detectives trying to find criminals. We need people to cooperate with us, understand that we're working on a health challenge that everybody needs to be involved with. In terms of isolation centers at the local government level, I think we're still not quite there yet. Some states have set up these centers at the sub-national level. We just visited Ogun State, I think, have centers at the sub-national. Asaba, Delta State has centers at the sub-national level, not in every local government, but in senatorial zones. So that's, when you don't have infrastructure over the years sufficient for a problem, you can't start suddenly by having everything. You start building from somewhere, and that's really what we're doing, and the states have been very proactive in doing this. There's a question of why we're not doing door-to-door collection. I mean, it's not really our strategy to go door-to-door to 200 million Nigerians to collect samples. We have a strategy of looking for people that meet the case definition, and even in communities where we're testing, we're not testing everybody. We're still asking, do you meet that case definition? If yes, we collect samples. On the question on discharges, this is data that is coming in from many centers around the country, so sometimes it's, it takes a while to get the data in. From the labs, it's a bit easier to get that data in, so we'll keep updating the numbers on discharges as soon as we get them. There was a question on masks and lockdown. So whatever happens, the mask can only be used in conjunction with everything else. So the mask is not a silver bullet. And this is something we've been emphasizing as much as possible. So the masks are an additional measure to everything else we've been doing, and we have to continue doing those things together. So yes, we have all started using masks whenever we're outside, but please, don't stop washing your hands, don't stop your physical distancing, do all of them together. It's only by doing it together that we'll get the effect that we want. So thank you very much.
Are not being carried along. Well, the Presidential Task Force continues to work with all state authorities, not only the task forces, but also the state commissioners of health and the state emergency operating centers. And we do have forums where issues are discussed. From the point of view of the detail of the patient that has gone viral, just to re-emphasize that health information continues to be personal. Confidentiality is not being put aside because of COVID. It is important that we continue to treat all our patients with dignity and respect. People have a right to their results. People have a right to know what is wrong with them. When it comes to public health, the right authorities will take action if there's a need for isolation. But really, when it comes to results, it's a personal thing that should remain with that person. What is the plan for mitigating the risk of COVID in persons working as healthcare workers? So here we're really talking about three things. One, training in infection control and prevention, because you need to know how to protect yourself. It's not just about the provision of PPE, which is the second bit, making sure that PPE is available across all the health facilities in the country, and also making sure that the PPEs are used rationally and they're used properly, because you can wear PPE and still contaminate yourself if you're not trained to use them properly. And then finally is the issue of education, being aware of the risks as a healthcare worker and making sure that you protect yourself, knowing the high-risk situations that you might find yourself, especially with regards to people presenting with unusual symptoms of COVID. Thank you.
Dr. Fiona Braka, WHO.
Chair of the PTF and honorable members of the Presidential Task Force, thank you for bringing up the issue of malaria. As we think about COVID, we also need to bear in mind there are other high-burden diseases that we should not lose sight of. On 25th of April, we will commemorate World Malaria Day to draw attention to the devastating impact of this disease on families, communities, and societies. As the world grapples with COVID-19, this is an opportunity to highlight the importance of maintaining robust health systems and continuing delivery of essential health services in times of crisis. The theme for World Malaria Day 2020 is Zero Malaria Starts With Me. It's a grassroots campaign first launched in Senegal in 2014, and it aims to encourage everyone from policymakers to the private sector to communities affected by malaria. African countries have led a massive effort to control the disease, and last year, Algeria was the first country to be certified malaria-free in Africa. However, every year, 400,000 people die of malaria, and 94% of these deaths occur in the African region. Children under 5 years are the most vulnerable group, accounting for 67% of deaths. We have, through the Sustainable Development Goals, a commitment by countries to eliminate or end malaria by 2030. And WHO's high burden to high impact approach is one of the efforts that WHO is supporting countries to implement to address this burden. Specifically in Nigeria, WHO is collaborating with the National Malaria Program to review the situation engage states on modalities for program continuation, and support states to identify innovative ways of delivering community-level services, especially long-lasting insecticide-treated nets and seasonal malaria chemoprophylaxis. The facility-based services for malaria diagnosis and treatment are ongoing at primary healthcare level, but they are challenged by low health-seeking behavior and fear of stigma. It's our hope that with the required financing, strong coordination, dedicated partners, and engaged communities, we can achieve a malaria-free Nigeria and malaria-free Africa. Thank you.
Distinguished ladies and gentlemen. Well, I'm going to respond to the question from the lady in Voice of Nigeria. Ìbéèrè tí arábìnrin wa láti Voice of Nigeria tí ó béèrè ní wípé kí ni àbájáde àyẹ̀wò tí a ṣe fún àwọn akọ́ṣẹ́mọṣẹ́ láti orílẹ̀-èdè China. Ìbéèrè yẹn gan wáyé ní àárọ̀ ìka tó wá sí báyìí, ṣùgbọ́n èsì tí a gbọ́ ní pé fún ìdí kan àbí ìmíì àbájáde yẹn àìtí ní lọ́wọ́ báyìí, ṣùgbọ́n mo fẹ́ fi dá yín lójú wípé ní kété tí a bá ti gba èsì àyẹ̀wò yẹn ó di dandan ká fi tó gbogbo orílẹ̀-èdè wa ní Nàìjíríà, àwọn ọmọ orílẹ̀-èdè wa láti jẹ́ kó mọ àbájáde, nítorí pé a ti sọ wípé a máa fún yín ní èsì àyẹ̀wò yẹn. So màá rọ̀ gbogbo wa wípé kí a farabalẹ̀.
Our consulate, we have a consulate in Guangzhou, which is the epicenter of this whole all the things that are happening in China regarding Nigerians and COVID-19. And the figure that was given, the official figure that was given, was 9 for Nigerians. And as I understand it from our consulate, they added that a number of Nigerians were asymptomatic, but the figures that we had were 9. When I met with the Chinese ambassador, and he talked about a plane that had come in to the country in which there were Nigerian passengers that subsequently tested positive. It was also within that range, 9, 12, 13. So where the figure 72 came from, I really have no idea whatsoever. The second question was about Nigerians in the UK and the whole issue of testing before boarding to come home or testing when they get home. Now, this is something that the task force studied very carefully and got all the best medical advice. And, it was finally decided that since there were some countries where it was not going to even be possible to get any testing done, that it was better, and maybe the DG, NCDC, or the national coordinator can further elaborate, that it was probably enough, that it is enough, in fact, that at the airport you just do the superficial testing, temperatures, and the general look if somebody is coughing or not coughing. And for reasons such as that, even if somebody at that stage, tested negative, it could be an incubation period, and they could actually be positive, and so on. So that it was better for all the normal precautions to be taken on the flight, and then to be tested when they reached the country.
Then I've been getting a lot of messages, actually, also. China. Another question on China was that the number of Nigerians who were there and who've quarantine period has been extended, and they're finding it difficult to pay because they're being asked to pay for their hotels. Now, when I engaged the Chinese ambassador, one of the things that the Chinese government, he assured me, were going to address and had started to address was the issue of the costs, the payments that our Nigerian brothers had to pay, and that the government was going to also look favorably at extending some assistance to Nigerians. And so that's one issue. But of course, to then say from there that their predicament is because of the delay on the part of the Nigerian government in evacuating them, is not totally correct, because you can only evacuate when everything is ready here in the country. And we have Nigerians who want to come back from all over the world. The numbers in UK alone is about 2,000. And the simple fact of the matter is that we just don't have the isolation centers and the hospital beds and so forth, and hotels to accommodate them all. We've been looking for hotels in Abuja and in Lagos. I spoke this afternoon with the governor of Lagos State, and it's a real challenge, even for the government of Lagos State, to find hotels that are willing to, to take these people in for the 14 days. A lot of hotels clearly, feel that it would damage their brand, it would have some effect on their business. And so that's being a real problem for us now. And then the other alternative is for people to then come back and be isolated in their homes. But when you have such numbers, some of the people on the task force feel that there's a risk that you will not have the guarantee that they will stay in their homes and be under quarantine. And it will be very difficult to monitor that number of people for 2 weeks. So this is a real dilemma that we're facing. And of course, you can imagine if they start coming back and then the numbers of positives and so forth start spiking, then the government will be now, blamed and said, but why did you, bring so many people back? So these are all the issues we're grappling, but hopefully we will find a solution to that. Now, in this context, the chairman of the Diaspora Commission, Abike Dabiri, has tweeted on her tweet that, that all the messages she's been receiving have been sent to the Honorable Minister, who has the final say, and another one that all directives as to COVID-19 come from the Honorable Minister of Foreign Affairs. Well, I'm certainly not that powerful. Mr. President has established a task force chaired by the Secretary to the Government, and all decisions on COVID are taken by this task force, certainly not by me, and as an individual, and to tell all those outside the country, to engage with our embassies, and we will communicate to our embassies and high commissions the decisions of the task force, not the decision of the Minister of Foreign Affairs. And I've been deluged with, all kinds of messages. My numbers have been given out, and just to say that it's not a decision, a final decision that I will take. But we are doing everything possible to make it possible as quickly as possible to start bringing back home a number of our people out there, and we know.
Engage. Function. Yesterday, somebody asked if we could intervene in private schools who charge money from their pupils or students. I am not sure we can do that, because all contractual arrangements made with private schools are as between the contracting parties. If schools reopen and want to run online and they have lowered or excused you from school fees for a period, or have granted discounts, or have asked for a particular kind of fee for that, that is within the domain of the contracting parties. What the Federal Ministry of Education does is implement the laws as they regulate the licensing, conduct, and delivery of what we approve as our syllable and curriculum in respect of learning and learning outcomes. That's what we do. Then I'll go to today's question. The main of your question is, how are these online classes being conducted, and in what relation to what I've asked that the SUBEBs do? Okay, I will explain to you. Online classes are the same thing as offline classes. You can download them and keep and learn them at your pace. Online can be real time if you're on the same wave at the time when it is being taught. There are many tools. But what the Ministry of Education has done is to synchronize the platform such that at the Ministry of Education Education website, you will then look at what is available in the different states. And we've asked that UBEC and the SUBEBs at the states coordinate to access this. We've also gone further. Yesterday, we released that in furtherance of our earlier brief on COVID-19, the federal government, through the Federal Ministry of Education, collaborating with the telecommunications sector and providers therein, have granted free access to all Nigerian students to the following e-learning portals: the schoolgate.ng and the mobileclassroom.com.ng apps. These e-learning platforms have been declared subscription-free for Nigerian students in primary and secondary levels during the period of this lockdown as initiated by the COVID-19 pandemic. It will be recalled that due to the pandemic, the Federal Ministry of Education announced the nationwide closure of all educational institutions as part of measures to curtail its spread in the country. Hence, the need to explore other avenues to deliver lessons to students. It was also disclosed by the Honorable Minister of Education, Malam Adamu Adamu, that Airtel Nigeria network users can already browse these e-learning platforms for free, while other telecom service providers like MTN, Glo Mobile, and Nine Mobile are currently making technical adjustments to their systems to accommodate the free access. This is a provision we've already made, and this is in relation to how you can access the platforms. The second arm of your question will relate to what the states are now doing in relation to assessing them. Is this bulk of papers I hold here. Every state has how they've programmed the lessons to be delivered. And I'll give you a typical example. This is Anambra State, for instance. For senior secondary schools, Mondays, they start with economics at 9 a.m. stroke 12 noon to 12 noon. And you can access that on ABS, that is Anambra Broadcasting Service, on 88.5 FM. This timetable is for every state. All the states have timetables like this for all the subjects: economics, physics, mathematics, biology, chemistry, English language, literature in English, and subsequently for each class. This type of timetable is already available for every state that is already has assessed this, and it is available on the platform I told you, so that you can look at the one that is relevant for your state on the Ministry of Education website, because I can't just read through all the timetable right here now. But this is how it is. You can look at Lagos State, you can look at every state that has a Ebonyi State, all of them that are online, and the radio stations and on what frequencies they are broadcasting them, whether they're on TV and at what time, for which class and for which subject. All of that relativity has already been meshed into what we have provided on the platform. So if there is anyone that you would like to access and you're confused about the timetable, you can get on our the ministry's website and access the state that you're looking for, and then you can discountenance that along your timelines. Thank you very much.
I think the question that was directed at my ministry has been partially answered by the Minister of Health, and that has to do with the health workers that were relieved of their appointments, I think, in Plateau State. We don't have the details too, but our duty in the Ministry of Labor is to act as conciliators in such a circumstance. And so for now, because we are very much aware of the impediments, if any such thing occurs now, with respect to health workers who suffer any kind of injustice from their employers, the impediments are that the courts are not open, especially the NIC is not functional. They can't rush to court and get relief. Even the ministries are closed for now. Perhaps they can try and get in touch with us through the ministry's emails, or even my personal social media handles. They send me a DM. I mean, these are unusual times, so we can adopt unusual methods now. They get across that we can make provisions to act as conciliators at this time. We understand the primacy of the work of health workers now, so we can make exception only for health workers to come out of our confinements and act as conciliators in such, quick conciliators in such cases. Thank you.
Honorable ministers here present, gentlemen and ladies of the press. First, let me start by saluting the very wonderful work of this committee, the COVID-19 Presidential Committee, that have been working around the clock, 24/7, to try to contain this pandemic. It's not an easy job, and clearly speaking, I think I want to also appreciate the fact that many of our states have keyed in. Mr. Chairman, let me also use this auspicious occasion to thank you immensely for the interface you have allowed to be happening between the committee, particularly at the highest level through your office, and the Nigerian Labour Congress, and by extension, organized labor. I think these are critical times, and I do agree that collective effort and individual effort is very, very important at this point in time. I assure you that we'll continue to be very reasonable. We'll continue to interface with your office with the whole idea of working together to achieve results. Let me also thank the Minister of Health, who has also tried to commend our health workers. These are very difficult times, and clearly I think I want to lend my voice to commend these frontline health workers that have been doing very wonderful work. We have continued to interface with them at different levels, and that's why we set up the Labor Civil Society Situation Room, where workers can actually phone in. Their unions can also phone in, and we can be able to intervene, especially at the state level, secondary health care and primary health care, especially in terms of provision of PPEs and other things. I think it's important we try to emphasize, as the minister said, the issue of scaling up occupational health and safety, looking at the number of health workers that have been infected so far. I think there is no gainsay that the health worker first need to protect himself before offering service to others. So I quite appreciate also the gesture that government is coming up with to try to support these frontline health workers. So as part of our contribution, the National Union of Textile and Garment Workers, particularly the tailors in Abuja, who are under that union, came up with a very wonderful idea to say that in order to support this fight, they needed to also think out of the box. They needed to use their skill and intellect to produce these locally made face masks. And they have so produced in large number. Our intention is actually to distribute free to other category of frontline workers. In fact, if you pass around the cities of Abuja, there are workers that their work is not so much recognized, but they contribute a lot. As early as 5 o'clock, I see people sweeping the streets. And these are people that don't wear masks. In most cases, trashes are thrown on the streets, contaminated. They pick them and keep our environment health. So first and foremost, we are going to distribute to them free, and also other category of paramedical staff that are also working, enforcing some of those decisions, but at the end of the day, they are not able to actually access this facility. So this is our modest contribution. I want to use this occasion to invite the chairman of the Tailors Union in Abuja. I think it can be replicated across the country because I think all your colleagues under the auspices of National Union and Garment and Tailoring Workers can also do this same initiative. Because the advantage of this locally made face mask is the fact that it can be washed. You can also iron it and reuse it. And therefore, if going forward, to make sure that everybody is protected, because the idea now is that since the disease doesn't have treatment, the best option is for all of us to be protected. And therefore, we need to scale the message down to the nooks and crannies of our country. And I think this ongoing effort needs to be commended, but I think this is why we are here, sir. So let me invite him to bring samples, and I will invite our... Not a free money. It's money that belongs to the pensioner. It is in the pensioner's retirement savings account. It is structured in such a way that he will continue to draw this money throughout his life. So clearly speaking, we need to protect those funds, and we need to also make sure that the pensioners or the workers that are contributing this money, at the end of the day, if they are not working, they should be able to have something to rely on. So clearly, I think it should not be used for this purpose. Thank you.
Thank you. Finally, we invite the SGF to the podium.
Thank you. Let me start by truly thanking the President of the Nigerian Labour Congress, who is also the President of the International Union of Workers. So he, like I said yesterday, not knowing that this occasion will happen today, that he's listening to his workers all over the world, not only the Nigerian Labour Congress. He acts in dual capacity. And when he comes to give an advice, it's based on an informed platform of the experiences of workers in different climes and in different jurisdictions. So your advice, your recommendations will not be taken lightly, because you are talking as a representative of the workers in over 100 countries of the membership of the union which you lead. So it's not an advice that can be treated with levity. We respect your opinions, and we want to thank you for this very good gesture of providing masks, and the kind of people that you intend to give out this mask for are people that really need it in these very, very trying times. And the fact that it's made out of our local fabrics, it's a thing that can be easily handled. Use it in the morning as you return home in the evening, you wash it, dry it, and iron it, and it's safe for you to continue to use it on a daily basis. So we want to thank you with the, by extension, the Garment Workers Union for this very, very generous and gratifying support that we have received from you today. And thank you for coming, and thank you for lending your voice to this national response. It's not a time for any joke. COVID-19 is here with us and is real. And as a nation and as a people, we need to arise and collectively give a response that will give some element of hope and respite to our people. So thank you with your team for coming. Let me answer the few questions that are here. The first one is somebody has complained that the Abuja electricity distribution company is threatening to cut off their light supply. You wonder, and you'll be surprised that I've equally been threatened by them. What that presupposes is that it's not a business that is controlled by government. It's in the hands of private entrepreneurs now who bought over the discourse, and they are in pursuit of making their money. But you have a leeway. I know that the Nigerian Electricity Regulatory Commission has a consumers forum where you can lodge your complaint if you receive those kind of threats. Well, I didn't have, I must thank you for the response. But at TVC, we had looked at issue of pension funds. As a matter of fact, we even got the Minister of State Education to do us a position paper. And our conclusion was that the time is not even ripe for us to go there. Because the entire world order, in terms of our economy, in terms of our health system, has been disrupted by COVID-19. And the consequences, nobody can imagine until probably the dust is settled. I'm being honest with you. The consequences all over the world. When I hear people talk about scarcity of reagents, testing equipment, PPEs, I say we have to reflect on these things. These are commodities that all countries of the world are in pursuit of. At the same time, everybody is looking for those materials. The sources themselves where they are produced are also looking for the same material. And because of the interruption in the production processes, everything has slowed down. So there is unimaginable scarcity. Yesterday I saw on Sky and CNN a plane load of PPEs arriving from Turkey into England. They have been waiting and they have been talking about that. We are waiting for PPEs. I say, Great Britain waiting for PPE from Turkey. That is the magnitude of what is confronting the world. The entire world economic order has come to a standstill and is being distorted and disrupted by COVID-19. So we will continue to push as a country and as a people. But I can assure you that God being on our side, this same thing would come to pass. Somebody asked about the issue of the 500 billion and whether the 48 million that was given by the Chinese yesterday is part of it. No, it's not part of it. The 48 million that was given yesterday are so many other contributions that are coming in. They go into a separate account that has been created by the Office of the Accountant General in about 5 banks, I think 5 commercial banks. On a daily basis, the Accountant General will move that amount of money and take it to the 2 central bank accounts that have been created for COVID-19. The 500 billion is a product of the economic committee that was going to look at the impact of COVID-19 on the economy and propose some economic interventions in different areas. And that committee is headed by the Honorable Minister of Finance, Budget and National Planning. They were set up with the task force at about the same time. They've got their own responsibilities. They've even engaged with the leadership of the National Assembly to see what budgetary and what legislative framework can be put around the expenditure of the 500 billion. We don't have control over that. That is an entirely different thing. Part of it will be used for COVID-19 expenditure. Part will be used to support manufacturing and all those things. So it's an entire package that the committee was given the responsibility at looking at. So the 500 billion is not for COVID-19 presidential task force to expend. The 48 million that was given by the Chinese and some other donations are going to be pooled into an account that is controlled and regulated by the Office of the Accountant General. The last question I want to take is this one about synergy between the federal government and the states. As a matter of fact, if there's anything that has consumed us in the last couple of weeks, it's building this energy and momentum. Because we realize that at the federal level, whatever level of success we achieve, if it is not translated to the states, the entire national response would collapse. Because the people live in the states, though Abuja and Lagos are the epicenters now, but we have seen seeding of the virus in different states. So we have encouraged the states to build capacity by provision of isolation centers. You remember one of the press briefings here, I spoke quite clearly that each state should provide at least a 300-bed isolation center. Because if you don't have a case now, thank God for it, but prepare for the worst. So we are working in a collaborative manner. Let me give you an example. We had to get the DG and the representative of the WHO to tour 9 states in 3-4 days, all in an attempt at building synergy. They met all the 9 governors. They had discussions with them, with the task force that have been set at the state level. They are replicating what we have at the national level. But in addition to that, they have their EOCs, emergency operating centers, where the experts congregate on a daily basis to review their strategies in their state. And the DG, Center for Disease Control, is online with them on a daily basis to know what is happening in all the 36 states plus the Federal Capital Territory. So we are working in concert. The national coordinator has held meetings with the commissioners of health of the various states online. The Honorable Minister of Health has just concluded a National Council of Health, I think this week, with all the commissioners in attendance via video conferencing. So we are doing everything to ensure that the states and the federal government have one national response. But at the subnational level, there are differences. What Kano is dealing with now is not what Adamawa is dealing with. It's not what Lagos is dealing with. So we understand these differences and the mode of operation might differ, but the content and the response is one. And the basic protocol that we have issued is what is guiding their operations in the various states. So I believe that we have built momentum and we are working as one team, because this particular pandemic is going to ravage our people and ravage our wealth if we do not put up one national response. And there's no we should not allow for a weak link in this particular enterprise. We must all work together to ensure that we succeed. Thank you.